Welcome to the show, everyone. It's going to be a wonderful weekend. It's going to be hot. It is also going to be Mother's Day, so happy Mother's Day to everybody out there. A lot of us have been hearing a lot of reports about this COVID. A lot of us, if you're not, you've got your head in the sand. I like to say the doc is in. I have with me Dr. Sean Southland, and he is the CEO and founder of NeuroHealth Solutions. Doc, you were on Sonoran Living this morning. You've been on before as well. Welcome to the show. I'm so glad you were able to be here today with us. And, you know, I want to kind of let you talk a little bit about you, because one of the things that when I've been listening to you, you've been on my show now several times, because you get to have this voice here and talk to lots and lots of people out there that you want to protect, you want to help protect, and let them hear some of the things about you that you put into place for people. But more than anything, I want people to understand also a little bit about COVID, because even though you deal with brain diseases, you also now are dealing with infectious, and there's a reason why the infectious diseases that you are, because you also told me on several times that you've been here that COVID affects the brain.
Absolutely.
So welcome back to the show, Doc.
Yes, thank you. Well, as we talked before, COVID-19 is a pathogen. It attacks the lungs. However, there's the pathogenesis, which attacks the rest of the body. What we're finding more and more is it just super excites your immune system. Your body starts to literally attack itself. And there's more and more neurological disorders that are being discovered from the COVID-19 pathogen. It worked well with looking for an intervention, because that's what we deal with acquired brain injury infections. Same idea. It's basically, if your body gets infected, it's going to respond a certain way. So the pathway or the transition into infectious diseases was an obvious one. But the passion was, hey, let's not let things get out of control. What can we do? And unfortunately, it's like a pebble of sand on a beach, or standing in the middle of the forest and screaming. But I still wanted to do my part. We've got 15 employees. We've all put together something that can help people. And the lucky ones are the ones that get to hear this message and do something about it. Of course, we've tried to let our representatives know. The other day I got something, I don't even know what it was. It was a survey. It says, let the president, hear your thoughts. And I told him what we got, and of course I didn't hear anything. But I don't know. We have something to help people, and we've always been working from an individual health perspective. So with acquired brain injuries and chronic disease processes, we always get the cases that nobody else can solve. So it was right in our wheelhouse to develop an intervention for the exposure, for the infectious disease cycle, and for the recovery of people that will be exposed and will get the infection and will need to recover.
We are live on Facebook, so I do want to say hi to everybody out there. Like us and follow us. This is, at this point with where we are in with COVID.
Yeah, about to go back to work, hopefully.
Are we recovered from it? How do you feel? I mean, did you say that?
No. You can expect to see COVID-19 cycle in and out of our population, just like the flu. It's here to stay. The fact that it's transmissible to animals and to humans, again,
that's kind
it's
of
here to
scary
stay.
to me.
It's and that's the problem, where it is the worst part of the flu. It's that it can transfer, between animals and humans and cycle in and out of our population. So it's a more aggressive virus than the flu.
And what makes me sadder is that my kids are not worried more about the dog getting it than me.
Yeah.
People about that. We love our animals, but of course it's very, very true. I like to throw a little humor in with some of this stuff.
Yeah.
It is serious.
It's
But, at the same time, I think what I love, and I say it every show, I probably say it almost every segment, is that this information you're able to get this out to so many people. And again, also the things that you hear on this show, or any show really, I call it Networking Arizona, because it is networking is talking about it to other people too.
Absolutely.
And you hear these things. Maybe you have a business that you would like them to come in and help you get your business up to snuff. And when I say up to snuff, how do I say it? Because you can.
Well, if you're an employer and you're worried about your employees, the first and foremost is to give people a path. There is an intervention out there, so people know what to do. The biggest problem with the unknown is, what do? We listen to the government, stay at home, which actually made things probably a little bit worse. And then, of course, wait until you're so sick that you have to go to the emergency care.
Which
well,
was
by
less.
that time, it's gone beyond intervention. And that is the problem. What they call mitigation is keeping you from dying. What we call mitigation is keeping you from the poor outcome measures, going through the infectious disease cycle with no deleterious or negative effects that are going to affect your health long term.
So let's talk about, first of all, your intervention program and also the website that you have that people can do. I'm going to let you talk a little bit about that and the tests that they can take. And people listen up to this. I honestly feel that everybody should do it. I've done it. I think everybody should. I've been on, you can talk a little bit about it. I just think that everyone should listen up and hear this. And I shared it too with everyone as well because I think it's important. Go ahead.
Well, the patients we have now, it's simple. If you haven't gotten it, you can go to our website and go to NHS COVID-19 and take the risk assessment. If you have gotten it and you've been through it, but you're having health effects, like you're having a hard time recovering, you can do the same thing. You can even call us on that one. You can call us 866-563-2682, and then you'll talk to a clinician, and we'll talk about how we can get you in, test you, find out where you're at, and help you along your path of recovery. And then, of course, if you have COVID-19 and you want to reduce the poor outcome measures, you want to get through the cycle quickly, you want to have some care management alternatives, then you can, again, talk to a clinician and we'll walk you through it. So basically, we're everything from being self-isolated all the way to before you need emergency or acute immediate care where you have to call 911.
Before you came on, when we were talking about this and the test, that you said that one thing that you wanted to get out there was that you want people to go forward more than just stopping and taking that test and saying, okay, yeah, well, it sounds like I got it, or it sounds like maybe I should really go the next level, but they don't.
Yes.
And I asked you why, and we don't know why, but people, why would you do that?
Yes, well, I don't know why they're doing it either. We are busy, obviously. It does take time to get in. We try to get you in as soon as possible. I think, again, a lot of people think, well, it's not really going to hit me. The problem with COVID-19 is once it hits you, you're stuck with what you got. In other words, you can be preventative now by doing the risk assessment, seeing where you stand, and get in for a therapeutic cycle. But if you wait until you get it, then you're stuck with what you got. And if you can get to us, we'll help you, but you're still not as ahead of the game as you could have been by being more proactive.
I was just going to say, the name of the game is proactive.
This is one time in our history of healthcare where being proactive and taking the initiative to take care of yourself is very, very important.
Go up on the website. It is NHS for NeuroHealth Solutions it's NeuroHealth Solutions, so it's NHSCovid19.com. And so you can go up there and take the risk assessment test. Like I said before, I believe that everybody should do this, and you can also call them. Don't just take the test and stop. When you really think, put your head in the sand, don't be scared, because the best thing is to know and to talk to the doctors.
Well, just knowing your risk factors puts you ahead of the game.
Exactly. Again, be proactive with your health. That number to call them direct is 855-777-COV2. That's what I have. And then, of course, go on that website and write it down. And if you want to tell somebody, please do. It's NHSCovid19.com. We're going to go to a break, and when we come back, we're going to talk further. This is important stuff.
Really quick, let's change that to 866-563-COV2.
You changed it on me?
Sorry about that.
So it is
We weren't really taking calls,
866
but 563
563
2682.
2682. We'll just leave it at that.
Yeah, sorry about that.
And I'll just say it. I'm going to take this text thing off because we're not doing that.
So what we're really seeing a lot now is a lot of stroke risk patients are coming in because they're realizing a lot of people are stroking out. What this does is it compromises your vascular permeability, increases inflammatory markers and oxidative stress. So if you had a pre-existing risk factor for stroke, it will exacerbate that considerably. And that's why all these young people are having strokes. So we've had an uptick in our stroke prevention. And I didn't mention stroke prevention because it's part of the COVID-19, but that's really what we've been doing a lot of. And then the other part is that people don't realize SARS itself builds up carbon monoxide in your tissues. And they have research has shown that after a SARS, which is what this is, SARS-CoV-2, it takes up to 5 years to get that carbon monoxide out of all of your tissues. And we have a therapy for that gets it out in 6 weeks or 6 days.
Wow. I want to ask you, because so many people have, like you said, there's some people that don't even realize that they even have COVID, and let's say somebody had light symptoms, just a little bit. Maybe they couldn't breathe that well, but it was not that bad to rush to the hospital, and they didn't. What, you know, or they're now feel better. Okay, they're feeling fine now. What happens then with someone like that? Do they still need to go take that test, see where they stand, and still, what is your thoughts on that?
Well, anybody who has a concern about recovery, clinically, we're gonna test them. We want to know what we're working with. But we just don't do COVID-2. We'll do a blood test. We find out what oxidative stressors they have, inflammatory markers, any of their organ systems that might have some issues that we need to look at. Because when you get COVID-2, it attacks everybody differently. And so you said something, well, when somebody thinks they have a difficulty breathing, well, that's actually a pretty significant symptom. So just because you don't go to the hospital, but you had a difficulty breathing, doesn't mean it wasn't easy. I mean, your body is still suffering damage. And that's why we have even young athletes that are dying. And even, you know, they have these kids that are having problems because if you're on a fast food diet, there's a lot of inflammatory markers in your system. That just typical bread diets cause a lot of inflammation. So they're also doing that. Well, wait a minute, why are we having all these young people that are dying? Well, a lot of young people sometimes eat fast foods, and the connection is inflammation.
Yeah. It's interesting because all of this information, I think people do slough it off, and they just don't. I think they think it's just not, it's not that big of a deal.
Right. Well, we got into the business of helping people, and again, being an interventional specialist, we're always dealing with people after the fact, and we see every time, if they just were a little bit proactive, they wouldn't be nowhere near this negative side effects of whatever, you know, situation they're in. Whether it's an infectious disease, whether it's a stroke, whether it's a trauma-related event from a TBI.
So welcome back, and we're talking with Dr. Sean Southland. He's the CEO and president of NeuroHealth Solutions, and we were talking at the break because everybody has questions, and I have a lot of them. And one of the questions that I asked you is that there's a lot of people out there that really don't think this is really as big of a deal as everybody's making it, and you know, maybe they have a light symptom and they are over it and they think that's fine, I'm done with it. One, you answered me is that this is, and you said it before too, is that this is the most important time, if ever, that people should be proactive with their health.
Absolutely.
And they should be no matter what, and we're not. Well, I don't understand us as a people why we're not.
Yes, well, I guess it's the American way, right? But I think what everybody needs to understand, when your body gets attacked and it goes through this infectious disease cycle, no matter what health level you are at, you are going to suffer some damage, period. Clinically, yeah, we're in the business of measuring that damage, finding out the weak links, and helping you restore that. We're set up that way. I mean, that's how we built the system. We built an interventional model to deal with care management of infectious disease cycle because we know it's here to stay. And we could have done it with influenza. Nobody gave that much attention to influenza, but now all of a sudden we're giving all this attention to COVID-19. But it's the same method. It's the same similar pathogenesis. It attacks your body, increases oxidative stress, increases inflammatory markers, attacks your organ systems, reduces oxygen, and causes a whole set of metabolic processes that literally is a health risk.
You also mentioned, and you mentioned other flus and how, I want to talk about the, what was it, the carbon?
Oh, well, okay, SARS in general. So this is SARS-CoV-2. severe acute respiratory syndrome. And it's very important that people understand that it builds up carbon monoxide in your tissues. And the research has shown that it takes up to 5 years to get rid of all that carbon monoxide that is built up from the SARS infectious disease cycle. And we have one of our interventional therapies, literally it's a 6-day therapy, and we can restore all the oxygenation into your tissues and push out all the carbon monoxide. Well, we're in that business. So every one of my employees does preventative care. They're all doing our therapy sessions. And of course the patients that come in.
The first thing to do is to go up onto the website, which is nhscovid19.com. The phone number, we're changing because they got a different one now, so I'm going to say it's a different one than I said before, so write it down. It's 866-563-2682. You can call them, they'll talk to you, but really the best thing to do is just go up and take the risk assessment test, find out where you stand with it, and give them a call. They're here to help.
Right, absolutely, and we're private pay and insurance. So, I mean, if people are worried about the cost, I mean, you'll be able to figure it out there. But yeah, we do have private pay also. And the reality is the money or the time you spent caring about your health today is going to save you months, years, tomorrow, period. I mean, it is what it is. As soon as you get the infectious disease, your body is going to be attacked nonstop until it either survives or ends up going into the ER.
It's a terrible, frightening thing, as a matter of fact, and I think that we are sloughing it off. And I'm one of them. I think I did in the beginning, and then I met you, and I was like, oh my God.
Well, and I see different patients, and somebody you'll see like a 30-year-old that's perfectly healthy, and you're like, wait a minute, how did that attack him that badly? And then you see some older, I just left with a consultation, and she's a 60-year-old, and she's doing amazingly well, and better than a 30-year-old. So I know we hear the media all the time, and then you're dealing with healthcare providers in the emergency sense, but there is a big area of care management and intervention that there's a lot to be said there, and a lot of things can be done to avoid any long-term debilitations.
This is something that everybody needs to take control of. We're going out there in the world now. We're all opening up a little bit.
Yes,
it's even scarier than before. I mean, we were talking many times, you've been on the show now, but how I said I've walked, it just happened the other day. It happened yesterday, where somebody came out, they were wearing their mask. I thought, wow, that's nice. But they weren't wearing gloves, and they were handing me something because now they have this pickup thing or whatever they're doing, delivery. It's all awesome, but you know what? If you're not going to do it, or you're only going to do it halfway, hey guys,
But what is gloves? Let's talk about the gloves really quick.
Okay.
You put gloves on.
Right, and so
if you get exposed, then the exposure is just on your gloves. If you touch something else, you're just passing it over. I'm not really quite sure what this idea is around the gloves.
So what my daughter was doing is every time she touched something, she'd take it off.
Unless you wear a box of, you have literally a box of 100 sets of gloves. Every time you touch something, you take them off and throw them away.
Right.
There are, of course, things you can do to make sure that your environment is sterile, and we do that. We help work with employers to do that. Yes. But again, we have to learn to live with the fact that this exists. The idea that you're going to outwit this invisible killer, I think we need to get over that part and start accepting, okay, well, what do we do about it? And that's why we built this care management intervention system.
Taking care of yourself, and go up online at their website. It is nhscovid19.com. Take the assessment test. That's the first thing to do. And it doesn't matter where you think you are, or if you think you're over it, don't. Have it done anyway, because when you take that test, you'll find out, and go for the whole thing. If you're anywhere near a level of whatever it would be.
Whatever your risk is, it's worth at least getting on the phone with a clinician. At least doing a telehealth consultation.
At the break, you talked a little bit on Facebook about stroke victims, and I think it's
really quick. It's very important to note that if you're at risk for stroke, they're finding more and more that this is exacerbating stroke. And so if you already know you're at risk for stroke, that's actually been a big influx for us. And again, children having strokes, younger people having strokes.
Are there more people that are at risk for stroke than other than being older, or what are some of the,
it's the typical, if you already have a pre-existing conditions. But no, I mean, even the AHA has a stroke assessment. I think it's 45 for men, 55 for women, or something like that. Do not quote me on this.
Yeah, that's okay.
But if you already know that, then
Yeah,
we've
if
seen
you
a
know
lot
these
of
things-
exacerbation in the stroke area. And it just happens to be that we already treated for stroke, so it falls into what we do, our purview that we've been doing for years. Another thing, again, is that carbon monoxide buildup. Just because you get through it, think of it this way. When your body gets attacked and you start to deal with all these infectious diseases or this cycle, you increase oxidative stress, inflammatory markers, then your organ systems are just prematurely failing. So think of it as like one day I'm 35 years old, 2 weeks later after having the infectious disease cycle, you're not 35 years old in 2 weeks. You're maybe 40 or 42 because it attacks your nervous system, it attacks your organ systems.
I was speechless only because I'm sitting here thinking, how many people with that would want that? We already want to make ourselves look younger on the outside.
Right.
If you don't
Absolutely.
take care of yourself, you know,
Right.
now
Well,
with this,
absolutely.
You're
We're in the
in-
business of helping people. So when we know there's a better way, I have no choice but to share it with the world because I literally feel like I'm ethically and morally obligated to do that. And we were already ahead of the times with our normal technology, which any clinician, we give tours all the time. It's amazing stuff. But the most important thing is people need to know you can do something.
and that's to go up on this website. It's so simple to do. It's nhscovid19.com. Risk assessment test. Take it. I mean, it's so simple, and it's a few questions. It's not a lot, and you'll find out exactly where you stand. Follow through. Don't just stop at finding out where you stand. Take that next step. Make that call to them. It's 866-563-2682. You also happen to say on Sonoran Living today, and
Okay.
I think we've talked about it. I watched it.
Yeah.
And I shared it as well with everybody out there. So I wanted to also say how people could test today
Yes.
and not have it, and then test tomorrow and have it, or the other way
Absolutely,
around.
absolutely.
Real quickly,
Yeah.
end with what you want.
Again, we're available to help all the way through. And if you're really worried about going back to work, I think you need that peace of mind. We all do. We built a system that is available from now until, yes, of course I hope we can get rid of COVID-19, but it's not going to happen. So it's a system we can live with, a place to go. And it's something that can be implemented across the valley, across the United States. It should be implemented worldwide.
Take care of yourself. That's what it's all about, and be proactive about this. All you have to do is go up on their website. It's so simple. They made it easy, and you'll find out exactly where you stand. It's nhscovid19.com. It is a scary world that we live out there, and these kinds of things are happening, and it's here to stay. It ain't going to go away. That number to call them direct, it's 866-563-2682. Again, it's nhscovid19.com.